Hatukuwa tunajua kama ukidhulumiwa unaweza enda hospitali hii, na hatukuwa tunajua kama kijana anaweza dhulumiwa, tulikuwa tunajua tu kama ni wasichana.
Sasa niko afya yangu iko sawa. Kama singekuwa saa hizi singekuwa natembea.
On the refugees living in Kasarani sub-county, I'm majorly from the Democratic Republic of Congo.
Resources are limited and sometimes governments don't have all the resources. So when we get into partnerships with other organizations like Afya, Zaidi, then they are able to bridge the gap.
After the Zaidi project, before it was started, we had a very good assessment. And this assessment was done with the community and also with the government.
So these needs determined what we were going to train them on in the sessions that I was now tasked to give to the community. That's how we came up with the Healthy Relationships Training Program for the youth 20 to 24 years.
Kama sisi vijana ama mimi, kuna vile tulikuwa tunafanya makosa, hata ukifanya usherati, kulala na kama na wasichana, unatumia, hakuna kitu yenye unatumia, lakini wakati tumefunzwa, tumejua vile tutajilinda magonjwa tofauti.
Here in Kasarani sub-county, I have a total of 72 community units. These 72 community units are spread across all our public health facilities within Kasarani sub-county. And to be specific, where the facilities that Hesed Africa is supporting, Hesed Africa is supporting Kasarani Health Center. And in Kasarani Health Center, we have 2 functional community units. We also have a Mazuri Health Center under City Ward, which has also 2 functional community units. And the Mwiki Ward under Mwiki Health Center, which has also 2 functional community health units.
Hofu niliabidiwa na rafiki. Juu mimi nilikuwa mgeni Mwiki. Sasa kama benye niko, nitakuelezea chakula yenye utakula, kunywa maji vizuri, na kupea dawa utakunywa.
Uptake of A&C services have increased. The uptake of family planning services has increased. The uptake of counseling services, mental health. Most people didn't know about mental health. Most people didn't know that when you are abused, you're supposed to be seen at the facility. So we created the awareness, and they know now that they have to access health services.
Sisi kama CHPs tuko na households kwa community, na wakati tunaingia kwa ile household tunaangalia pia age. So tukipata hao young girls tunawaelekeza hapa kwetu kwa program.
For example, this topic, drug and substance abuse, there are those children who comes from those slums, so they know all about these drugs. So when we tell them the effects of these drugs, they are able to change.
One thing about teenagers, they're very curious. So the ones who are not members, when you go back to class, they'll ask you, hey, what was going on? What did you talk about? And all that stuff. So you used to tell them and say, hey, it was fun. We were given things. Even sometimes you were given some things to go with them at home. The ones for the personal items, and the other ones which can help you. So when they saw that, they were excited, and you'll tell them that what you've learned. For example, if you learned about gender-based violence, you could explain to them if they were in a difficult situation, what will they do?
The runners have knowledge on it, and they can be able to handle themselves. They can be able to talk to others with even courage. They have the right skills. They can know how to handle themselves, how to handle others, how they can help the others. So it has helped them. And at long last, even we left them with the clips, they can continue watching with the projectors. So they will continue with the program.
Nutrition, I would say that it has helped a great deal,
because the majority of those people never used to come for, we would not even reach them, because when it comes to also nutrition, we go, the CHPs usually visit them. So health-wise, we are improving, especially on the care, especially on the under 5.
Tulikuwa tunakunywa tu maji kawaida, wakienda kileta maji tu unakunywa, lakini kuna madawa wanatupea, tunaweka kwa maji, hiyo tembe moja kwa 20 liters. So hiyo pia inatusaidia, hata hiyo ugonjwa haikudi sana. Hata wanatupea hata na dawa hii, dawa ya minyoo watu wanatumia sana. So wametusaidia sana.
So the project was keen on supporting CHP activities and also giving them supplies, basic supplies like aqua tabs that are used to treat water, giving them condoms, giving them nets and all those things, and also the meetings where we get feedback as a facility to assist us in planning.
Malezi Bora happens twice a year, so in May and November. When we had the May campaign, we actually had a big gap of the albendazole from government. So we used what Afya Zaidi had provided for us, and it not only helped us in the 2 facilities where we have worked with them more, but the entire, I think over 40,000 tablets were actually spread out to the other facilities. We were able to reach many schools through the supplies that we had gotten through Afya Zaidi, and it was the fulcrum of the success of Malezi Bora.
When they came in, we didn't have enough community units, so with their partnership, a community unit was born in Maji Mazuri, and also we didn't know how to deal with the refugees, so also they onboarded.
In one of my facility, that is a new facility called Maji Mazuri. It's a very new facility that is not well equipped. This facility didn't have a computer, and we are supposed to do the data reporting at the facility point. We were able to get a computer from for the facility through Hesed. So one of the areas that we were able to achieve very well is reporting. Because the health worker who is working in that area had to go to the cyber, used to go to the cyber, upload the information on their own account.
Before Hesed wakuje tulikuwa na issues mingi including we are living with some refugees. Wengi wao hawakuwa na information about family planning. Wakati Hesed imejaribu sana kuwa train kuhusu family planning, na ni ya kwamba tumeona matokeo, because even these refugees wamekuwa wakipata information, na you can tell kwa sababu wamekuwa hata kwa mahospitali zetu wakiendea family planning.
Also the number has also gone up, especially for the refugees. This is also simply because they have seen that we are working with them. The fact that we were able to bring on board their own CHPs was enough to make them now have confidence. So they are actually coming to seek services here.
I am happy because we have made some steps and we are moving in the right direction, and they have helped us.
And of course, when we're also doing this to make sure that the center runs very well, we had also to engage other infrastructural things like water tanks and stuff, so that when you're even leaving the project, the structural things that somebody would want to say that there's no water running facility. So we made sure that it was standard. So all those were supplied in the facility.
The biggest challenge was the number of students the pupils to be involved. You know, when you go to a school, mtoto wote anakuangalia, anataka that knowledge.
I think I would recommend that we expand the reach and scope of the beneficiaries in the Kamukunji and Kasarani sub-counties. offering them the comprehensive services that have been identified.
So in this regard, I would say we do mother and child. However, when the child now becomes sick, that is the clinical aspect, we are limited to that. So if the scope can be increased, then that will go in handy.
So I'd recommend maybe if they can support that, the psychotropic drugs also within the purchases of maybe supporting the hospital or health centers with other medical drugs, they can equally boost the component of mental health drugs that can also be used.
So an extension would go a long way into ensuring that the services that the population received keep coming to them.
In case we would come back for the same project, we still have to put more emphasis on sexual reproductive health and gender-based violence, especially amongst the refugees.
Hii program iko sawa, but ni vile imeisha tu haraka.